morning, everyone. My name is Odion Oviagela, and I am a health policy ambassador for the Lister Hill Center for Health Policy. I'm really excited to welcome you to today's webinar, Pursuing Equity with Legislation. This event is co-sponsored with the Institute for Human Rights, and it's the 5th installment in the Lister Hill semester-long spotlight on LGBTQ health. More information about this event series can be found on our website and on social media. Next slide. So before I introduce our speakers, I'd like to point out a few things on your screen. So this webinar is available in a listen-only mode. Please use the Q&A box at the bottom of your Zoom window to submit questions for our speakers. The speakers will answer questions after the presentation, okay? Additionally, we are providing live captioning for this event, which can be enabled through the bottom menu as well. If you're experiencing any technical issues, this webinar is going to be recorded and it will be posted on the sponsors' websites for future viewing. And on to our speakers for today. So today we'll be discussing LGBTQ equity through a legislative lens. I'll briefly introduce our speakers, Professor Walter-McCabe and Representative Neil Rafferty, and then let each of them talk about the work that they do. And then we'll have a few questions for each of them, and then we'll move on to audience Q&A. So Professor Heather Walter-McCabe holds a joint appointment at Wayne State University Law School and Wayne State University School of Social Work. She began her career as a social worker at a pediatric tertiary care hospital, working with families whose children had significant medical needs. After law school, she directed a public health research program examining the impact of firearm violence. She later served as the executive director of the Center of Law and Health at Indiana University before joining the faculty at the Indiana University School of Social Work. Her research is done at the intersection of law, social work, and public health. Her research translates complex legal issues and research findings across multiple professions to make information accessible for use by practitioners and advocates in improving population health. As part of this work, Walter-McCabe was a Robert Wood Johnson Foundation Public Health Law Teaching Fellow from 2014 to 2016. Most recently, she's leading research examining law and policy impacting LGBTQ health equity and well-being. She's published in traditional peer-reviewed academic journals and law reviews, and has also been sought by media to explain core issues of public health policy. Walter-McCabe serves on the executive board of the American Public Health Association and is a contributing editor to the Journal of Social Work. Representative Neil Rafferty is the state representative for House District 54 in the Alabama House of Representatives. He's a Birmingham native and a Marine Corps veteran. After his term of service in the military, Rafferty used his GI Bill benefits to earn degrees from UAB. Go Blazers. Rafferty's lifetime of service has been at the core of his career. He has worked to advance the interests of our communities underserved as the Director of Research and Development at Birmingham AIDS Outreach, where he works as the director for the Birmingham Comprehensive High Impact Prevention Project. This project addresses health disparities through intensive collaboration with community members, partner nonprofits, the CDC, state and county health departments, and clinics to implement community coordinated public health strategies. Since entering legislature in 2018, Rafferty has been an outspoken and avid advocate for women's health, minority health, LGBTQ and racial equity, veterans issues, and Medicaid expansion. He chairs the Democratic House Caucus Platform Committee. In the legislature, Rafferty sits on the Sunset, Health, Economic Development and Tourism, Transportation, Infrastructure, and Utilities committees. He has been appointed to the Veterans Suicide Task Force, the Opioid Overdose Addiction and Treatment Council, and the Joint Legislative Task Force on Budget Reform. He resides in the Crestwood North neighborhood with his partner of 16 years, their dog, and 2 cats. So now that we've introduced our speakers for today, feel free to go ahead with your presentations. Uh-oh, you're muted, Heather.
2021. All right. Can you see the slides okay?
Yes.
Great. Thank you all for asking me to be here today. I'm happy to be here to talk about this. I wish I didn't need to be, but I think that this is an important issue that we need to talk about right now. And if I can get my slides to work here. So why this topic and why now? Certainly, it's something that has been important for a while, but this year we're seeing a lot of action in the states. So it, last year we saw the Bostock case in the U.S. Supreme Court provide some additional protections or affirm protections for those who for workplace against workplace discrimination for folks with due to sexual orientation and gender identity. And this year we are seeing states taking action, particularly impacting people who are transgender and transgender youth. And so I'm not going to read through all of these, but this is from a list that there is a website at the bottom if you're interested in seeing more. But there are lots and lots of states working on some of this legislation in many different areas. So I wanted to just give a little context, and I'm not sure who all is on the call. And so I apologize for those of you for whom this is a repeat. But I do like to, when I do these talks, just give a little overview for folks who maybe don't have a lot of background in this area. So we say LGBTQ, some people say LGBTQIA, some people use other acronyms. But I think the thing that I want to touch on today is that there are different parts of when we say LGBTQ, we're talking about a lot of different things. So, for example, someone has a gender identity. Each person has their own gender identity, and that is how they identify. They may identify as a female, male, other, non-binary, woman, man, boy, girl, but that is how the person identifies. This is different than gender expression, which is what maybe, which is how they present themselves, or maybe how others view them. So maybe you're feminine or masculine, neither or both. Um, so keep in mind that gender identity and gender expression can be two different things. There's also sex assigned at birth. So that is when you are born, what the physician puts on your birth certificate. And it can be female, male, or intersex other. So for some folks, they are born with secondary sex characteristics that may not be in one particular binary area. And so those are what we call sex assigned at birth. There's also physical attraction, or some way we refer to this as sexual orientation. So you may be attracted to men, you may be attracted to women, you may be attracted to both or neither physically, or you may be attracted to people just emotionally. So keeping in mind that sexual orientation, gender identity, gender expression, and sex assigned at birth all have specific meanings that are different from each other. And if you have questions about this in the Q&A, please I'm sure Representative Rafferty could speak to that as well. But I think it's important to know what we're talking about as we're having some of these discussions. So why discuss stigma and policy? So a lot of my work is around policy and public health. And I will be very upfront and say I think that the conversations we're having today around legislation have a lot to do with public health, because I think that it has a direct impact, and I think research shows that it can have a direct impact on the health outcomes for people who are impacted by these policies. We're going to talk about some of the health disparities in the LGBTQ community, and then talk about some of the theories regarding this disparities. And then we're going to move into having Representative Rafferty talk a little bit about some of the legislation in Alabama, and hopefully we can have a good discussion. Policy can have an impact on stigma and social norming. And when stigma exists, it has an impact on health. And so let's look at that. So first of all, as I was looking at these slides, I saw lots of this kind of negative stuff. You know, I need to redo my slides and put some pictures of some folks, happy folks. Like this is simply talking about risk factors here. LGB youth are 2 to 3 times more likely to attempt suicide. They're more likely to be homeless. A lot of this happens around unaccepting families and inability to stay home, not all of it. Um, Lesbians are less likely to get preventative services for cancer. Gay men are at higher risk for HIV and other STDs, particularly among community of color. Certainly, I don't want to miss the opportunity to say, we need to think about intersectionality. So when people belong to more than one group, it can more than just amplify. There's interaction between those different statuses. Lesbian and bisexual females are more likely to be overweight or obese. Elderly LGBTQ individuals face additional barriers to health because of isolation and a lack of social services, which are culturally competent to serve them. And the LGBT populations have higher rates of tobacco, alcohol, and drug use than other groups. But specifically for today, I want to talk a little bit about risks that are specifically to transgender individuals. So they're an increased risk for mistreatment and violence of discrimination against people who are transgender. In the latest survey, that was a national survey of folks who are transgender, nearly 1 in 10 respondents were physically attacked in the past year because of discrimination against persons who are transgender. So that's 9%. 12% of respondents reported being verbally harassed, physically attacked, and or sexually assaulted when accessing or using a bathroom in the last year, so 12%. Certainly, transgender individuals are at increased harm for mental and physical health. 39% of respondents experienced serious psychological distress in the month prior to completing the survey, compared with 5% of the general population. 40%, and I'm going to repeat that again, 40% of respondents had attempted suicide in their lifetime. That is 9 times the suicide attempt rate of the US population, which is only 4.6%. And 8% reported having urinary tract infections, kidney infections, or other kidney-related problems in the last year as a result of avoiding using public bathrooms for safety issues. So I think it's also important to point out the picture that you see of the women on the screen are Black, well, not all, but Black and Hispanic transgender women who have been murdered. The concern about violence because of stigma towards this group is real and concerning. And we shouldn't forget that as we're thinking about legislation that impacts this group. I want to talk about minority stress theory because I think it's particularly important to this discussion. Minority stress theory was developed in 2003 by Elon Meyer, and it posits that stress and stigma bring about adverse health outcomes, including physical and mental health disorder. The stressors themselves can cause some of these adverse health outcomes. Policy has the capacity to exacerbate or improve stressors, such as systemic discrimination in communities. Stigma is a multi-level construct, so it can be really at any level. We can have individual stigma, which can be someone who kind of hears all the stigma and things against them and starts to internalize it, feels they need to conceal who they are. Interpersonal, it can result in abuse, rejection by family, discrimination, and then structural stigma are those stigmas that are exacerbated by state policies, institutional practices, and all of these kinds of stigma can have an impact on the health of folks who are impacted by it. Mark Hetzenbuehler has done several studies looking at health outcomes in its relation to policy and stigma. And I pulled just one of these studies, but looking at sexual orientation disparity and psychiatric morbidity in states with higher forms of structural stigma. And if you look at the data, blue is the number, or excuse me, the rate of cases of dysthymia, which is a form of depression, generalized anxiety disorder, PTSD, and then comorbidity would be more than one. The blue is states that have protective or are rated protective towards folks in the LGBTQ community. The red is the health outcomes in states that are rated not protective in their policies towards the LGBTQ community. And there's a real difference here. And it was statistically significant. And I said before, we have ways to make things better. Policies can be used either to exacerbate the problem of stigma or work to change societal norms in a positive direction for communities. So how do laws impact the population, and does it always matter if a law is passed? So there's more work to be done to study this, but I'm going to show you this slide. And I am going to posit that we know that stigma can exacerbate poor health outcomes. We know that policy can have an impact on that. What type of stigma is created when people wake up and see these kinds of headlines day after day, or have to go to state houses and defend their personhood year after year? When what does that have on stigma? So I just encourage you to think about how even having the conversation itself can be stigmatizing and potentially have an impact on health. So I don't want to sound all doom and gloom. There have been some positives. There was a case in December of 2020 that went up against the Supreme Court that was denied certiorari. In other words, they refused to see it, which left standing the lower court, ruling that a transgender student can use the bathroom that conforms with his gender identity. So that was positive. Certainly the Bostock case I mentioned at the Supreme Court level made it so that workplaces cannot discriminate on the basis of sexual orientation and gender identity. That's a positive. There have been some positive changes in the Section 1557 of the Affordable Care Act, which is the anti-discrimination provision, which was recently is being looked at to ensure that it is inclusive of gender identity and sexual orientation, whereas it had been changed to not include those before. So there are some positives, but I think we need to continue to have a real look at what we are doing and how we can ensure that through policy we are not perpetuating more harm and causing worse public health outcomes for a whole group of people who are already disparately impacted in health. So I'm going to leave that up and to turn it over to Representative Rafferty to talk a little bit more about what's going on in Alabama.
All right. Well, thanks, Heather. I thought that was a great presentation. Really appreciate that. I learned quite a bit. I was sitting here just jotting down notes as you're going through everything. So appreciate that. I guess first and foremost, can everyone hear me okay? All right, good. So on taking that lead as far as talking about policy and what's going on here in Alabama right now, is there are two bills. There's actually three bills, but two of them are exactly alike. This is a procedural thing. I'll explain that in a second when I break it down. But that are addressing these issues and trying to wage a cultural war in one way or another. Now, when I first saw these bills come across onto the docket, I was concerned primarily that this shouldn't turn into a cultural war, that this is a bipartisan issue. Transgender individuals are just as diverse as everybody else, and so are their families, the ones that would be caring for their transgender minors and children. So the first bill I'll talk to you about is HB 391. This is the kind of colloquially known as the Trans Athlete Bill. This is the one that would preclude anybody from playing a sport in K through 12 schools here in Alabama if they are not, preclude them from playing a sport that did not match the sex that was designated, their biological sex that was designated on their birth certificate. Obviously, this is an issue, particularly when we want to talk about transgender individuals. The NCAA, the IOC, both have made concessions to allow transgender individuals to play in the sport of the gender that they identify with. In fact, the Alabama High School Association, during the Education Policy Committee, where this bill was first being heard, said that the bill wouldn't be necessary because they already have policies and procedures in place to take care of this issue. Additionally, there's some other potential ramifications with this when it comes to cisgendered individuals. And I'll give you an example. There was a girl who was several years older than me, but at a middle school I went to, and when she wanted to play football, she was a very strong cisgender girl, but could keep up with the boys just fine. And when she wanted to play football, they signed her up and let her do it. Under this law that would then become statute, that might not be permissible anymore. So there might be those unintended consequences there. Additionally, with some bills, particularly with the trans bathroom bill, we saw a lot of ramifications and loss of economic development funds and loss of sort of sporting events that could happen here in the state of Alabama through the NCAA and other organizations who have championed inclusion and equity and equality within their sport. So that's HB 391. Where that one is it has gone through the House. Just last week, it passed the House, despite my protest, despite many people's protests. It wasn't just me, need to be clear there. Then it's still got to make its way back up to the Senate and then go through committee and the Senate, the whole process there. So there's still has quite a bit of maneuvering to do before it would become law. But that's where we are right now. And as Heather was saying earlier, it's not so much the issue of it getting through, but we're talking about including and attaching stigma to this issue and exacerbating kind of a mental health or just a feeling of social exclusion and stigma as a result of this bill just making its way through. The next one I'll talk to you about is HB 1 and SB 10. So that means House Bill 1 and Senate Bill 10. And what this is when you introduce a bill that's the exact same in both the Senate and the House, and then they can move through at the same time. So this one has passed the Senate. SB 10 has passed the Senate and has now come down to the House and has passed the House Health Committee there, despite, once again, my protest. What this one does is it does several things. For one, is there's a lot of shock and awe involved in it, and a kind of a solution in search of a problem, kind of tries to speculate that there's this problem that needs to be addressed through legislation. And I can say that, for one thing that it tries to paint clear is that there are procedures and permanent, permanent physically altering procedures that are done on minors. This is not part of a standard of care with any reputable medical organization, including American Academy of Pediatrics, American Academy of Family Medicine, American Psychological Association, American Academy of Child and Adolescent Psychiatry, as well as the Pediatric Endocrine Society. So what we have is folks who don't really understand the gender affirming model, don't really understand what it is to be transgender and to have the transgender experience, but are trying to legislate to and tell these families, these parents and who are surrounded, what I said in committee meeting was that it's like taking all of us a body of 105 people with 35 in the Senate, so that's 140 people, and it's sticking us in the room with parents, the children, and the healthcare team that treats this holistically treats this whole patient, this whole family system, in order to with the gender affirming model. And even though we don't, not all my colleagues have, many of my colleagues have tried to understand it and have come quite a ways, but many of them just simply don't get it. And why it's important. But at the end of the day, it's us saying, you don't know what you're doing, you don't know your child, you don't love your child, and you don't know what's best for your child. At the end of the day, that's what it is. So that's one thing that this bill does, is it blocks things like surgeries, which once again, I've already said that that's not something that is in any standard or model of care that's practiced here in Alabama. But it also blocks or makes a felony, just to be further elaborate, the use of puberty blockers, the use of hormones that would be of the opposite of the gender that the child begins to identify with. But once again, this is not a problem either. These medications have been used in minors for at least 30 years and have been proven to be safe. And have also, but with informed consent, as with any drug, nothing's perfectly safe. But the doctors I know that have been practicing this always walk through informed consent with the parents. They always try to reel everything back in and make sure that they're taking it very slow for this transition, if it's gonna happen that way. So something else that's happening here is, in addition to that, there is a mandate on teachers, school counselors, principals, and other administrators, any sort of trusted adult any kid might have in school, to be able to, somebody that you might feel comfortable with before you might be comfortable talking to your family and your parents. I know for me, I didn't come out immediately to my parents when I was 13 years old. It started off with my sister, and then I had a teacher that I trusted, and then eventually, and I was always encouraged to tell them when I was ready. So it was always like, there was nobody ever trying to tell me, don't ever tell your parents. There was just people saying, we encourage you to do it, but make sure that you're doing it when you're ready to do it. This would totally take that autonomy out of that child's hands, and force and compel school officials and these trusted adults who this child has come to for comfort, or to just be able to vent and express and maybe just talk about what's going on in their lives. But it compels those trusted adults to out the child to the parents. Now, in my case, my parents were very loving, supporting, and came around to be very affirming folks. And I couldn't make it through my adolescence without them. But this isn't the case for everyone. If we want to look at youth homelessness, we can say that 40% of homeless youth are LGBTQ identified. And we know that this is a result of neglect, abuse, or getting kicked out of the house, or just not feeling safe at home for whatever reason. We never know what's going on in somebody's head, and within those closed doors of that family unit. So that's terrifying to me, is that we would be forcing, compelling people to out their children and break that trust and that confidential trust that they have with this trusted adult at the school, and then put this kid in potentially a uncomfortable, at the very least, but at the very worst, dangerous situation. So I think we have to make sure that you're working with the child in order to come up with a plan here. Once again, never encouraging the child to withhold that information, just encouraging the child to to share that information when that child is ready to do so. And that's what those two bills are doing. So right now we're all just kind of waiting to see what's going to happen, and if they come up to the floor for a vote. And if they come up to a floor to a vote and they get passed, then I would think that the governor would be the last stop here. And I don't know, I haven't talked to her or her office about these bills yet, because I've been working hard and trying to make sure that we're staying, we have a good defensive posturing in the House to prevent these bills from going any further. Now, and that's where we're at. I'm happy to elaborate more on those issues and kind of where we are with them, but you can see that there's a multifaceted attack. I mean, not attack, multifaceted. Well, it certainly feels like an attack. I'm not going to lie. Let's be real here. And this is part of what I think Heather was talking about earlier. About I have a webinar later this week that is with the trans community exclusively, and the point is because they are suffering from some of them are suffering from distress from not really knowing what's going on, only knowing that they're hearing that anti-trans bills are making their way through the House. And that's scary when they have to worry about all these other issues, as Heather so eloquently put forward there. And this is just an extra layer of stress. And if you wanted to go back to the concentric circles that I think Heather had in her presentation, we're looking at adding a whole other level there on that ring when it comes to policy and institutional stigma that's coming down. So my goal and my job and what I want to do on Thursday when I talk to the community is hear them out, but also hopefully empower them with the information of what's going on here. So this is a big deal with very serious ramifications. Even just the discussion of it can be a potentially serious ramification. But I think that as we move forward, we need to also make sure that we have strategies, not just political ones, but legal ones to challenge it if it gets to that point. And I believe there are some stakeholders and some groups that are already prepared to do so. So I just want the trans community out there, all the trans youth out there, to know that I know it's hard hearing all this. I know it's difficult. I can say I'm not trans, but I was a young gay kid one time, and I know what you're going through, and I got your back.
Thank y'all so much for that. That was wonderful. Thank you, Heather, for going over that research, and Neil for talking about those anti-trans bills in Alabama. So I want to start with both of y'all. Earlier, Neil, you mentioned that a lot of your colleagues backing the anti-trans bills don't understand the harm that these bills can cause. And as Heather pointed out earlier, there are a great deal of stressors like systemic discrimination, abuse, et cetera, that lead to poor health outcomes in LGBTQ communities. And at times it can feel like there's this significant gap between policy research and policymakers themselves. So what do y'all think are some good strategies to bridge that gap?
Well, I would certainly say that we need more education on the subject. See, so part of the narrative that's being pumped out there by proponents of these bills is that there is that transgender has become a fad. It's just something popular that the kids are doing now. And I think that what they're doing is they're misunderstanding the whole idea that kids are just now coming up with different terminology to identify things that have always existed. We're talking about difference between visibility and prevalence. The prevalence is probably remained the same. The only difference is now there's greater visibility of the community. And there's more kids, the younger kids they're more open to it because it's something that they see more often. So I think that we need to really be clear with them, and I try to make this point to them, that there's not a greater prevalence. We're just talking about greater visibility, that these folks have always existed. Then there's also this kind of pejorative kind of look at gender, and they say, you know, like, and I'm sure you've seen right-wing memes and this kind of stuff too, where they say, well, what are there, 47 genders now? You know, and they make kind of a joke, a mockery of the whole idea, with forgetting the concept, the biblical and philosophical concept of a mirrorism, right? So you have, mirrorism just means you have a binary, but the binary includes everything in between. So, and you know, I'm going to get a little religious here, so pardon me, but if God created heaven and earth, he didn't just create heaven and earth, created everything in between as well. If God created man and woman, he didn't just create man and woman, but everything in between as well. And I think that that's a way that, you know, at least I've been trying to talk to folks to try to understand that when we say the 47 genders, it's not really that there's that many different genders, it's just that there's a spectrum, and that people are starting to name different parts of that spectrum, so that they have something so that they can identify themselves, so they don't have to just, you know, they don't have to fit themselves into a box, but they can be their own unique individual, and you know, and express how they feel on the inside with more meaning and with more substance. You know, one of my strategies last year with this bill was to introduce as many people as I could to trans youth, who were very polite, upstanding. I mean, it was just wonderful to see them be able to bravely go in there and share their stories with these people. And I know for a fact that they were able to touch hearts in there. It's not that, but it was brave of them to have to put themselves out there, to go up to this legislator who they might feel a little intimidated by, and just open and earnestly share their story and why that this is such an important issue for them. So I think lifting those voices up, the families' voices up, these parents that have come from one, you know, from one side to other of the issue, but they've done that only because they love their child. It's all about that. So
yeah, I would
so
agree.
these are some.
Go ahead.
Sorry,
Sorry.
I've talked plenty now, so please.
No,
Somebody else.
no, I echo what you're saying about the youth that have been really at the forefront of this, and the bravery and doing this often at their own detriment, where they're in front of, and I'm not speaking to Alabama because I have not heard youth testify there, but certainly at the federal level and other places, there have been instances of youth who have bravely gone before legislators and told their story and been misgendered and it is harmful. It is harmful. You know, people, I mean, I believe it's a human rights issue, but perhaps people can disagree with things, but to actively harm youth, which, let's name it, is what that is doing. And I think that there's a real question of understanding. And I think what Representative Rafferty was saying about understanding, and for people who at least think they don't know anybody who's transgender, that there's this othering of it. So getting to know people and making sure, I again love the point about making sure we're supporting the trans community in what they need and want to do here is important. I've also done things, you know, I think somebody put in the question and answer, what can we do? One of the things that I did was call my state senator, because we have some stuff going through in Indiana as well, and offered to come in and just have like coffee and conversation about some of the medical data that's out there, some of the WPATH, the kind of the body that creates the ethical standards for treatment of gender dysphoria, have that kind of conversation and go over, again, from my perspective, some of the public health impacts of these kinds of laws. And so really using opportunities to try to teach, and I really respect Representative Rafferty's approach to the way that he talks about this, because I do think that trying to educate and softly confront may be necessary. because of the way that opposition can happen, and we get so intransigent in our stances. So I think that it's really important to think about how we approach this. Um, and I saw Representative Rafferty get somewhat emotional. I share that. I am very, very concerned about the health ramifications for the transgender communities in this country right now. I'm very fearful for them from a health perspective. Um, and even having these conversations, how many times can you defend your humanity without it being harmful? And I think it's important because I do think um, if you even look at the name of some of the bills, people are trying to protect kids by doing this. And I think that some education around how we may be significantly harming some kids while in the name of protecting them might be useful to people who are willing to hear some of the data that's out there.
Thank you all for answering that question. Also, I linked a toolkit by the ACLU of Alabama that lists contact information for lawmakers in Alabama for those looking to reach out to their lawmakers and make noise about these anti-trans bills. Just wanted to mention that. So I'll go ahead and move on to the next question. So Heather, as a researcher, what are some practices that you've seen in legislation that are meant to address LGBTQ health issues that improve health outcomes, or have you seen any? And if you haven't, which ones would you like to see?
I mean, I think there are states, there's the MAP project. I don't know if folks are familiar with that, but if you just look up MAP project LGBTQ, they actually have rankings of states for how protective they are for LGBTQ folks. And if we think about protections for workplace, protections for hate crimes, early adopters of marriage equality, and one of the data points that was used to talk about minority stress theory and to show some data around the nature of being able to have better outcomes with better policy was states that were early adopters of marriage equality had better health outcome for their LGBTQ populations. So I think anything that doesn't other LGBTQ folks and pushes for equality, because we know with other areas, I mean, Jim Crow is gone, but is all racism gone? No, right? Hopefully, and some of the data on Black infant mortality shows that states who did away with some of the Jim Crow type laws earlier had changes that made infant mortality better sooner. And so those are the kinds of things I'd like to see. I'd like to see states first, at least not implementing harmful legislation, but also implementing legislation that does say that discrimination against LGBTQ, gender identity, and sexual orientation are wrong and won't be tolerated in the state. And I think we do need to also watch some of the Religious Freedom Restoration Acts. In some states, they are specifically written in ways that would harm LGBTQ communities, even though they aren't anti-LGBTQ on their face. Many of them are written in essentially in response to some of the court cases protecting LGBTQ individuals. And so, how do we ensure folks that certainly we want them to be able to practice their religion? That is not the issue. I am a member of the queer community, but I grew up in the church, in my church of choice. But I think that it's important to be mindful of these things and the impact that it has on health. Did that answer your question? I'm not sure if it did or not.
It did. It did.
Okay.
Thank you. So my next question is for Neil. And so I'm not a legislator, right? And so I was wondering what the pushback from other legislators looks like in real time when you know, are on the floor and you're trying to literally debate the humanity of trans kids. What does that pushback look like in real time?
Honestly, there hasn't been much pushback. And if there is, it's usually something about religious beliefs, which I quickly, can retort that by saying, well, you have a whole community of LGBTQ Christians. So do we really want to go religion versus religion here? I usually get, well, what about, then there's clarification, like, well, what about the surgery? Well, those don't happen on minors. Well, what about the dangers of these medicines? Well, according to Mayo Clinic and according to all these other doctors, they're performed and administered with informed consent and very slow rollout, and making sure that everyone knows exactly what any of the risks are associated with them. And then the doctors closely monitor for those risks as they get through, go through that procedure. So, but typically there's quite a bit of sympathy. The thing is, to get that sympathy, you have to really sit down with somebody and talk to them for a long time. I usually share my story with people as far as like the coming out and how dangerous it can be to be forced out of the closet. And that usually gets people really thinking a little bit there. Now, is it working? Only time will tell. What I can tell you, this will not happen. What will not happen is that bill makes it to the floor and it is voted down. That will not happen. Because it's, and I hate to say this because it's going to sound very callous, but it is an uphill messaging battle. The problem is that we have the trans community is so small and such a small proportion of our population that not enough people know them or know about them. So the concern would be that they feel like they don't need to go out there and be the ones that have to defend these kids by defending how they voted on this bill. Does that make sense?
It does.
So I think that this is, task us in the community and as leaders in the community, make sure that we're getting that message out there. And we're not just sticking with our bubbles, that we are talking to people outside of our bubbles and that we are educating them there because they are receptive to it, okay? And I know that because I've been in those shoes before. I've sat down, I've started from scratch with somebody and I've worked my way through these issues with them. And have ended up with understanding on the other end. Maybe not total agreement, but at least a little bit of doubt, So what we're not, even at this point, we're not trying to persuade people to become, trans flag waving allies. Right now, we are just trying to get people to have a little bit of doubt that what they're want to pass here is not the right thing to do. Not the right thing to do for, it's not the right thing to do for your communities, it's not the right thing to do for your constituents, and it's not the right thing to do for our state. So that's kind of been the goal, because that you're pressed for time. You only have so much time before you can before it falls back and gets passed, if you don't make sure that there's just enough doubt there that what they're doing is going to be detrimental. So
yeah. Thank you. And so I'm going to shift gears here a little bit. So at UAB, there's actually an ongoing effort to establish an endowed professorship in LGBTQ health studies. At UAB School of Public Health. Okay, so you're familiar. What do each of you think that this sort of position should entail?
I go first? I looked at that. I looked at that. I think that was a question that someone had sent in before. I mean, I love, I think that you said that it's in the School of Public Health, right? I love that it's in the School of Public Health, because I think that really looking at this as a public health issue and maybe even a public health crisis is important, because it is a certainly it's a civil rights issue. There's lots of different issues, but I think that people often can understand the health issue and even, cost. What's it costing us? Not even just in terms of human beings in their lives. What's it costing us to do some of these things, pass some of these laws? And so I would love to see that. I would love to see someone who both does some of the traditional epidemiology type research, but also someone, and again, I mean, of course, with my background, I'm going to say this, right? But I think somebody who is really interested and knowledgeable about using research to examine the interface of policy and health outcomes, because I think that it's going to be extremely important over the next few years, and for people like Representative Rafferty, who's needing to build relationships with his colleagues and talk with them about this in a way to try to get understanding. If he has good data to bring to them and can tell a story with that data, because I think that's important too, that story piece, that personal piece with data, I think he's going to have a much more compelling case than if we haven't done that kind of study that really seeks to see, because maybe some of the laws don't matter as much. Maybe we don't need to fight as hard on X, but on why we better be really, really talking with our legislators and really making sure they understand the impact. And so I think that would be useful. And to the point that it could be inclusive and making sure that they have a good reputation with the LGBTQ community, or at least good relationship with them, I think would also be important.
What about you, Neil?
What was the question again?
Yeah, no. The exact same way. So we're establishing an endowed professorship in LGBTQ.
Oh, right.
UAB in the School of Public Health specifically, and we were just wondering what you all think the position should entail.
Well, I mean, I think Heather said it perfectly, and I don't know if I have anything else to add to that, to be perfectly honest.
That's fine.
Other than just really trying to well, here's something I can say. So in Alabama, we have this saying down here, particularly in the legislature, is if it's not an Alabama problem, it doesn't need an Alabama solution. And if it's even if it is an Alabama problem, we do need an Alabama solution. So I think that having an endowed chair of LGBTQ health within the School of Public Health could really help us focus and hone in on and have the research and the data to tell the story of LGBTQ Alabamians. So I think, once again, I think people kind of forget that just because, I had one of the proponents of this bill last year said, well, I heard about this going on in California. I heard about this going on in New York. I just want to make sure it never came down here to Alabama. And I remember saying, essentially, this is last year now. And I remember saying, you're right. This ain't Alabama. This ain't California. This is Alabama, and this is our home too. So we're gonna, take an ownership of this land of ours. That this is, I have just as much of a right to be here and live here, thrive here, work here, and raise my family here as anyone else does. So I think that chair position can have a real meaningful impact on providing the data and support to kind of paint the picture, not just nationwide and help contribute to that, but also to paint the picture here for Alabama.
But an important point to what you just said too is somebody who either has or is willing to learn how to have conversations in Alabama about this topic.
Right.
And because I think that matters. Having had some of these conversations in Indiana, it can be challenging, and there are ways that are helpful and there are ways that are not helpful. And so I think having someone, again, it doesn't have to be somebody who comes in knowing that, but somebody who acknowledges and is willing to think about what those conversations look like in Alabama in terms of policy would be really important.
Awesome, thank you. And so my next question is, if, and for both of you, but a little bit more specific to Alabama, if HB 10 passes in the House, and I guess also sister bills for people living in other states, how should constituents respond?
You mean if if it's the pass becomes law, like
Right.
it becomes an act, it's no longer a bill, it becomes an act.
Right.
How should we respond? Is that what your question is?
Yes, that's the question.
Very swiftly. So I think that once again, if that means that the political strategy has failed, and that means that the political strategy is problematic anyway, because of the once again, there's just not enough of people who kind of see the issue eye to eye with me. There's plenty of them, but is it enough to do it publicly? Do not know. So I would say that then we need to focus on legal strategy at that point. But I have not been involved in those conversations, and I don't really know what would happen. But the bottom line is you have to protect these kids, and you have to protect them and make sure, and their families, and make sure that they are able to get the treatments that they need. Right now, there would be no concession or grandfathering in. So this means that, you know, upon signing of that bill into the passage, there'd be 30 days. There'd be a 30-day period before it would become illegal. And after that 30-day period, it would be a felony for a doctor to prescribe those medications to a child, regardless of the situation we're in. So I think that it's going to be very important that that there's a legal strategy involved in order to contest it and make sure that these kids are still able to get a hold of the life-saving treatments, and not just treatments, but the medical and mental health care. I mean, we're not just talking about that. We're talking about, you know, mental health care as well here, and making sure that they're able to get all that before. We just got to do everything we can. Then it'll be all hands on deck at that point. So if this gets through, man, it should be all hands on deck now, but it should really, if it gets to that point, then it's like, okay, what are we going to do to commit, you know, to make sure that these kids can be happy, they can be left alone, and that their parents and their healthcare teams can still provide these life-saving standards of care to these children.
Thank you. So we're approaching 10 o'clock. Do y'all have any closing thoughts before we end the event today? It's okay if you don't, no pressure.
Thank you for having me, and wishing good wishes to the folks of Alabama as you're dealing with this. And I think that Representative Rafferty said earlier, you know, to let the trans communities know, you know, we're with you, and or at least
got your back.
Yeah, we've got you. And
back.
so everything we can. You're not alone. Yeah.
Awesome. Well, thank y'all so much for coming to this event today. You guys have provided some really great insight. Thanks to all of our guests for attending. Remember to click that link in the chat for folks in Alabama that want to reach out to their representatives about these anti-trans bills. But with that being said, I hope all of you have a great Tuesday.
Thanks for having us.